The pharmacy leadership response has been clearly evident during the pandemic. Pharmacists have continuously been a frontline open access healthcare profession, the experts in medicines whom you do not need an appointment to see. Not only supplying medicines and managing patients' medication therapies, but also providing essential services such as chronic disease prevention and monitoring chronic conditions. Pharmacists and their teams are making an incredible contribution to healthcare provision during the pandemic. At the start of the pandemic, when the country was near enough total lockdown, there was an even greater dependence on pharmacists as a first point of contact to fulfill the public's healthcare needs. Many doctors' surgeries had closed and moved on to phone appointments. Pharmacies were one of the few places that were kept open for the public, making pharmacists and their teams a fundamental healthcare provider during the outbreak. The public turned to their pharmacists, who led the provision of support and advice during this time and remained on the forefront of public health by serving as direct points of access for their patients. Disseminating accurate, current, and evidence-based information regarding COVID-19 to the public was also a key focus for the profession during the pandemic. All of these additional responsibilities were rapidly taken on by the pharmacist and their teams, as well as continuing with normal service provision of medication supply and management and the usual essential services. It has been an extremely busy time for the profession as a whole, who have shown great leadership traits of perseverance and diligence during this time. In the first few weeks of the pandemic, the workload had almost tripled in some areas, adding to increased pressure and burden to the pharmacy teams. Through solid teamwork and working above contracted hours, they were able to manage their patients' needs above and beyond expectations. We have had cases where pharmacists themselves have been delivering medicines to patients to ensure continuity of care, as well as managing patients' fears and concerns regarding the coronavirus, which has contributed to mental health issues in some patients. With fake news circulating regarding breakthrough treatments that can save lives, pharmacists are best placed and have been offering the correct advice and support around medication use and risks to the public, as well as members of the healthcare teams and policymakers. The profession gained a long-awaited recognition from the government during the pandemic as a reliable, informed, and credible resource and an integral part of the NHS family. COVID has highlighted the importance of pharmacists and their teams with regards to the role and the support that they offer to the community. As we move out of the acute phases of the pandemic, we need to cement the recognition received during this time, that we are an integral part of the healthcare team and leaders within our own right.